well. But today's presentation will include some immunization information, and Martha will go into some interesting communicable disease information. Neuro, how far do bacteria fly? Will be a test question that you'll be posed with. And then we just thought it would be helpful to give some common health inspection violations so that you kind of getting back into the recovery from COVID where we're at. And then lastly, in our communicable disease section, we'll talk about hand hygiene. Kara will do a bit of an update. I'm sure you're all fully aware of the lead water testing requirements, and Kara will give you some links and some updates. And then we'll have our partners that are on the call give us their updates. And lastly, you'll see throughout the presentation, the Health ECE at bouldercounty.org is still your go-to for all of your health questions. Of course, Kara and I and Tori and Kyla and many others, Heather Hosworth, are available for all of those kinds of questions. So we'll go ahead and start the conversation. I think we have Robert on the call. He's going to give us a little update on immunizations.
Yeah, hello. Hi, I'm Bob Jenkins from the Boulder County Health Department. I work in the IZ team. I'm a COVID lead nurse, and I also do vaccines for children clinics. And yeah, maybe. So here is some links. So this first one is with the CDPHE, and it has the link where you can look up to see how your preschool is doing as far as compliance with shots and immunization rates. And it has all the preschools and all the grade schools, high schools, universities, and college, and all the preschool through high school in Boulder County, and then the universities. And then it's pretty easy to navigate. And it also gives you the rates, the overall rates for MMR for different counties. So there's a couple different things you can look up, and it's very informational. It's very good thing to look at. And then the next point here is if you have any questions regarding rates or anything related to that, you can contact Tavio, and that's his email there. And he's the data unit co-manager. And then if you have any other questions, there's the phone number and the email contact. And I'm filling in for Marcella today. And so she would be the one who, she's a good person to contact, and there's her email in the bottom there. Next slide, please. Okay.
Bob, those were the extent of our immunization slides, but if you have anything else.
Okay, yeah, I was just going to touch briefly on, try to give you some clarification on, there's a lot of confusion about people don't really know when they're fully immunized, because maybe they've had four shots, and they think they're fully up to date, but they aren't. So you're up to date if you've had at least 2 primary monovalent shots and at least 1 bivalent Omicron booster shot. And so the Omicron booster shots didn't come out until August 31st, 2022. And so if you haven't had a shot since then you probably aren't fully covered, because you probably haven't had the bivalent booster shot yet, even though maybe you've had 4 different shots. But if you've had a shot since August 31st, 2022, then you probably have had the bivalent booster shot, and you're probably up to date for now. But there'll probably be some changes in the fall. Maybe a new shot will come out. And if you're over 65 or immunocompromised, within a week or 2, they should be approving a second bivalent booster shot. And that's all I have. Just wanted to give clarification on that, because there's a lot of people are really confused about it, because it's been very fluid and changing, and it's been confusing. So anyway, that's it for me, unless anybody has any questions.
Thank you, Bob. It has been confusing, and I also just wanted to remind everyone that we'll be sending out these slides, so you'll have this contact information. But you can please put any questions you have in chat, or you can unmute and ask. I know we have a few minutes if there is some immunization questions. I think between Kara and Martha, they're watching the chat.
Jane, there hasn't been any questions so far in the
No
chat.
questions. Thank you.
All right, thank you.
Thank you, Bob. So then I'll turn it over to Martha.
Okay, well, thank you, Bob. And I know quite a few of you. I started in September. I'm an epidemiologist and dietitian, so I'm kind of the bridge between the child health promotion and the communicable disease department. So whenever you write an email to healthece@bouldercounty.org, I'm the person that replies. So thank you so much for utilizing our services. I'm going to give a quick COVID update. So the reporting is the same as in January. Many of you probably heard our presentation in January. And just to remind you, the definition for a confirmed COVID-19 outbreak in an ECE facility is, go ahead, Jane, is 5 or more people with COVID-19. And of those 5 people, 2 of them need to be confirmed with a PCR test, and that's within a 14-day period. Next slide. And if you want to order your free COVID tests, you can order them no later than April 14th. So today is April 10th, so you have 4 days. And thank you to Meryl Lee, who's putting all this information in the chat. So if you click on your screen on the word chat, you'll see all of these links that Meryl Lee is putting in the chat. So, okay, next slide. Okay, so I'd want a little audience participation here. So if you could type in the chat, first of all, have you been experiencing more illness in your child care facilities this year compared to years past? And if yes, I'd be curious if you type in the types of illnesses that you've been seeing this year. Interestingly enough, when Kara and I have been doing health inspections at your facilities, kind of anecdotally, people have been saying, yes, we've been experiencing more COVID compared to years past. Someone just wrote in COVID. All kinds. What would be some specific ones, Kristen? Or Rain? What types of illnesses? Because I bet other people from other facilities can relate. Vomiting, diarrhea, coughs, fever from Mary. Yeah. Pink eye. Lots of strep, croup, and stomach bugs. Yes, we've been noticing that as well. And then a lot more upper respiratory infections, says Judy. Really all of the illnesses, says Rain. And we've been noticing that too. So thank you so much for keeping us informed about those. And go ahead to the next slide. And so based on feedback from all of you, our epidemiology team and I have been working hard to update the illness logs to make it quicker for you to fill out, as well as more readable for us. And so in the chat, Meryl Lee will put a PDF of this illness log that you see right here that you can print out. And we got feedback it didn't fit on one page to begin with. So thank you to Mary Mann. She helped us a lot with that. So you can print it out and put it on one page. Or Meryl Lee will also put in the chat an Excel document that you can type in there directly, whatever works best for your facility. But the main changes, you can see we have name there like before, but then student and staff, because often I'll come back and ask, was this a staff person or a student? And then the class or the group. and the onset date and time. And then the next ones, you can just put check boxes. You can just check, was it vomiting, diarrhea, cough, or fever? And then if you have other symptoms, you see that little asterisk there, and you can see you would just have to put A for abdominal cramps or M for muscle aches. And then if there's a positive or negative diagnosis, we want to know both. And if, let's say it was a COVID, we would want to know, was it a positive PCR or a positive at-home test? And then we're curious, the next two lines is very helpful for us in knowing what recommendations we have and guidance. For example, did the symptoms occur at school? For example, was a child having diarrhea at school, or did the symptoms occur at home? Did a parent call in and say, Matilda won't be coming today because she has a bad cough? So those really help us as epidemiologists know the guidance that we should give you. Okay, next slide. So it was interesting for me to see all of the different illnesses that you've been noticing recently. And the state of Colorado combined all of the outbreak information that each of your facilities in Boulder County provided to us, as well as all counties over the state of Colorado. And you can see of the GI illnesses, and enteric is just another word for GI, outbreaks in schools and childcare facilities between 2015 and 2019, most of them were caused by norovirus. So 83%, Shigella was about 2%, Salmonella about 1.5%, and then less from there. I think for me, the most important part of the statistic is about 94% were transmitted person to person. So that means through touching each other, or touching other children, or putting toys in their mouth. Consequently, since 94% of these diseases were transmitted person to person, these are things that we can really take control of, and there's lots of things that we can do to prevent this transmission. Okay, next. So today we're going to focus on norovirus. So a lot of you had written in the chat, you've been noticing more diarrhea and vomiting, and it could be norovirus. And norovirus causes diarrhea and vomiting and is very contagious. And so other people, it can be infected really easily. And children are more vulnerable. And I'd love for you to put in the chat, what are some reasons that you think that children might be more vulnerable specifically to norovirus? Go ahead in the next slide, Jane. But please go ahead and start putting in the chat, why are children more vulnerable to norovirus? They don't wash hands well. Perfect. Yep, they're just learning about the 20-second rule. They have decreased immune system, sibling exposure. They put everything in their mouths. Exactly. Perfect. Thank you so much. And go ahead, Jane. I thought that picture of a baby was so cute. So I think you've gotten all of these. Hand washing. They're just learning about, hand washing, mouthing, highly interactive with their environment. Was a nice way to put they touch everything. Go ahead, Jane. They're learning about toileting. And as you all are aware of, a sick child often means a sick teacher. Next. So we're going to watch a little video, but I took a class on how do adults learn best. And one way that adults learn best is we have such a big knowledge base, and basically we just want to fill in those gaps. So I'm going to have some questions, and I'd like you to put the answers in the chat. So the first one, how many particles of norovirus can make you sick? So go ahead and put your answers in the chat. We'll start with the first one. How many particles of norovirus can make you sick? And maybe that's something you've never thought of before. Like, is it a lot or just a little bit? And if you don't know, that's fine too. And then if you want to put in the chat, so one person, thank you so much, Kristen. So 10 norovirus. Yeah, and another person, I've never thought about it, but I imagine not a lot, says Amy. Yeah, good point. And then the second question, again, go ahead and put your answers in the chat. How many feet does norovirus spread? So think of if you're sitting down at your preschool during story time or circle time, how far should you actually clean if a child happens to vomit during that time period? So think about how many feet does norovirus spread? And then, yep, 10 feet. Thank you. 2 feet. Yep, great, great. Yep, this is perfect because I think then it gets people thinking along those lines. And then when we watch the video, we'll find out the answer. So thank you. And then the third question, how long does norovirus stay on surfaces without using a disinfectant? You think it's hours, days, months, years, 2 hours, 4 weeks, 2 hours, 4 weeks, 48 hours? Yep, all good answers. Okay, so now I want you to think of those questions, and Jane's going to start just a short video. And it's called, How Far Do Sneezes and Vomit Travel? And there's actually people that measure the distance, so scientists that help us learn those things. So then we know a little bit more about. It's not showing yet. No.
I'm just getting it queued up here. Hold on.
Okay. So, and I saw in the chat, thank you so much. So Marilee will email them out, or we will, through the Health ECE inbox, we'll email out the illness logs. So thank you so much for that quick feedback.
Coughs, sneezes, and vomit travel way farther than you might think. I'm Anna Rothschild, and this is Gross Science. For decades, researchers have wondered exactly what happens to the liquids that fly out of our noses and mouths when we're sick. But how do you track tiny particles of phlegm or barf and the microbes they carry? Well, back in the 1930s, Harvard scientist William Firth Wells gave it a shot. Wells used sneeze powder to make whole rooms full of people sneeze at once. Then he sampled the air and found it full of bacteria, though less so if he let his subjects use handkerchiefs. These days, scientists can use high-speed cameras to see the juicy details of sneezes and coughs. That's what researchers at MIT did in 2014. They found that droplets in a cough or sneeze travel on an invisible gas cloud, which can carry germs much farther than people previously thought. Small droplets can fly all the way across a room and can get sucked into ceiling air vents, which could spread them even further. And that's not all. To study what happens when someone's really sick, scientists in the United Kingdom built a robot called Vomiting Larry, who's basically just a head and a stomach. The researchers were studying norovirus, which is a nasty bug that causes nausea, diarrhea, and projectile vomiting. To simulate the act of puking, they filled Larry's gut with fluorescently dyed water. Then they made him retch it up. The dye showed that Larry's puke particles scattered farther than they would have been able to see with the naked eye. One projectile vomiting episode could actually contaminate close to 84 square feet. That means viruses might linger in places we think are clean. And in the case of norovirus, those germs might stay active for days or weeks outside of a host. Recently, in a study with a different vomiting machine, and yes, there's more than one, researchers at North Carolina State University found that some viral particles can be suspended in air after puking as well. The numbers were pretty small, but in the case of norovirus, which these scientists were modeling, as few as 20 particles can cause infection. And when these viruses get into their next victim, the cycle of splatter starts all over again. Ew. Got a question about how far germs spread? Let me know in the comments. And for more gross science, hit subscribe.
Thank you, Jane. Okay, so to answer our question, as Jane goes back to the main PowerPoint. So the first question was, actually I can remember. Oh, how many noroviruses actually can cause disease? And go ahead, you can unmute yourself or put it in the chat. So how many noroviruses was? 20, exactly. And does anyone know, compared to COVID, how many COVID viruses would you need to have in order to get COVID? Interestingly enough, go ahead, Jane, it's 1,000. So just 20 norovirus particles compared to about 1,000 viral particles cause COVID-19. And the next question was, what is the distance? How many feet does norovirus spread? You can go ahead and unmute or put it in the chat. And when you think of this distance, I want you to think about, yeah, thank you, Mary, 84 feet, 84 square feet. So think about, that would be in your facilities, that might be the minimum spread could be a circle rug. So then if you're cleaning up after someone vomits, you should actively look for toys that people could put in their mouths, or water bottles, or maybe utensils. Anything that could be put in the mouth should be disinfected. And then the last question was, how long does norovirus stay on surfaces? And again, go ahead and unmute yourself or put it in the chat. And again, note these are surfaces that were not disinfected. And just on a side note, we had a facility last week that had a spread of a GI disease, and we asked them, what do you use for your sanitizer and what do you use for your disinfectant? And when we did some research into it, the sanitizer is approved on a normal basis, but during a norovirus outbreak, her sanitizer was not approved to be effective against norovirus. So anytime you have an outbreak, make sure that your disinfectant is effective, as well as your sanitizer is effective against norovirus. So, yep, days and even weeks without disinfecting. Okay, next slide. So how can we prevent this? Well, so next slide, I'd love for Meryl Lee, who's been wonderful and manning the chat and putting all of these links so you can easily access them in the chat as well. But when we talk about how long can norovirus stay on surfaces, Meryl Lee has an example of a soccer team and a plastic bag. So take it away, Meryl Lee.
Thanks, Martha. Please let me know if you can't hear me. So I just am going to share a quick example so that we can better visualize what the spread looks like from a vomiting incident of norovirus. So in this particular example, it's out of Oregon. There was a soccer team, and one individual on the soccer team became ill with norovirus. This person was completely isolated from the rest of the team. They were kept in a separate room with their own bathroom, with one parent chaperone caring for them. And then the parent chaperone took them home on that same day back to their family. About 48 hours, 72 hours later, they did have additional spread through other team members. And the state health department was investigating to identify how, without direct person-to-person contact, was this spread throughout the team. And it really helps illustrate the importance of fomite transmission. And that's the idea when a human being has contaminated an area, but they've since left the area, and then people either touch objects or enter the room where someone has been ill at a later time or date. So as Martha was talking about before, we do know that there is some limited role of norovirus in just being able to inhale virus particles. But one of our more important transition routes is that fomite transmission, something that's on a surface. So in this particular instant, there was a Trader Joe's reusable shopping bag that was inside of the bathroom, not near the toilet. And I know we just learned about, the minimum of 20 particles. We've seen as few as 12 and the minimum of 84 square feet. In this instance, it was closer to 15 or 20 feet away from where the toilet was. But because each time you flush, you can aerosolize particles even further. So beyond that spread within the toilet, each flush can help spread, and even that initial incident into the toilet can spread throughout the entire room. So in this instance, the shopping bag that was open on the top, it had grapes, packaged chips, and packaged cookies inside, that 2 days later were consumed by some of the soccer team just by the contamination on the outside of that bag and on the food packaging inside. That's how it spread to the other individuals. So I think that that helps to kind of visualize that while there was food inside of a bag on the other side of a room and vomit was being flushed down a toilet, that people that were staying in a separate room that then consumed that food and touched that bag 2 days later were infected. And for me, that helps me picture, if there's a vomiting incident in a classroom, where are the water bottles being stored in relation to this, those utensils, where are toys being stored in relation to this, so that we can kind of prioritize anything that's intended to be put in the mouth for disinfection. What questions, if we have time, about this particular situation do people have? Nothing? Okay. Did I explain that? Okay, Martha, is there anything else you'd like me to touch on a little further?
I think they're overwhelmed with that. They're absorbing it, really.
It is a lot to take in to know how infectious norovirus can be. But for me, that doesn't mean that I need to go and sanitize and disinfect every single piece of a classroom, but to focus on the immediate radius around the incident. And then to look outside of that at really targeted things, like we said, water bottles, utensils, or toys that are intended for mouthing would be the greatest bang for your buck to focus on.
It's a great example. Thank
Yeah.
you.
Thank you, Marilee. And I think I love statistics and data, but it's often the stories that I remember better to help cause my behavior change. So thank you, Marilee, so much. So now get your fingers all active here. So how would you try to prevent norovirus? So yeah, washing your hands is frequently is the best way to stop the spread. And interestingly enough, if you look at the alcohol-based hand gels, they do not kill norovirus. So if you were going outside and eating food outside and you just were allowed to bring, and you didn't have easy access to running water, the alcohol hand gels just, do not kill norovirus. Next. And then disinfectant. So we often have a lot of questions about which disinfectant works the best or what do we recommend. I think it's always a combination. We need to be practical. So we do have bleach is effective and it's not very expensive. And you just have to mix it at the proper ratio. But depending on the bleach, it can be a 5 to 10 minute contact time. There are some products out there, Oxivir and Purell, and again, read the label for those, that just have a 1 minute contact time. And so those, especially if you're doing diaper changes and you have 10 kids to do a diaper change before a meal, what is more practical, the 1 minute or the 5 to 10 minutes? So often then during an outbreak, we, recommend, thinking of what is more practical during that time period. And then exclusion is at least 48 hours. The children and staff should stay home after the diarrhea and vomiting symptoms have resolved. Next slide. Okay. How many of you remember in 2019, there was a large norovirus outbreak on the western slope, and it actually closed more than or closed 46 Colorado schools. And you can see there were a lot of articles that even made national news as I was looking up different pictures to put in here. And there was so much public vomiting that people were handing out cleanup kits to businesses and even people cleaning the sidewalks. So you might ask yourself, next slide, what should I have in a cleanup kit? How can I prevent the spread? And there's a link there, which you can look up of where to buy just a cleanup kit, but you could also, I'm cheap, and so you could also just look at all of the kind of ingredients of the vomit cleanup kit and create it yourself. And you can see there that the Purell food surface sanitizer is the picture there, and that has the 1-minute contact time against norovirus. And that's what they were handing out on the western slope. So I just think as you go back to your facilities and, you know, talk with your staff, just the concept of having a cleanup kit at all available for when those emergencies occur. Next slide. Okay, so what are the public health reporting requirements if you do have any GI issues or norovirus? If there's just one person, so single cases do not need to be reported to us at Boulder County Public Health, but if you have clusters of illnesses, so clusters are anything that's above baseline for your facility. Often facilities will ask me, is there a certain number? And unfortunately, I can't give that because some of you have 4 children, some of you have 150 children at your facility. So we really rely on you as the experts of your facility. And we rely on you to contact us if you notice that this seems unusual this week and it seems above baseline for your facility. And then you would just contact us with Boulder at our email and send your illness log, and we can help you with how to prevent the spread in your facility. So big picture, the key takeaways: norovirus, very contagious. Children are vulnerable. It lives on surfaces for days to weeks without disinfecting. That's why it's so important to disinfect. And then it can spread in an area of 84 square feet. Okay, so when Kara and I come and help with do the health inspections, our goal is to collaborate with you to prevent children, staff, and then the parents and the bigger community from getting sick. So I have a question for you. And please again, unmute or put in the chat. What do you think when Kara and I go around and do the health inspections are the most common health inspection citations at Boulder County? What do you think are the most common violations or things that Kara finds that people aren't doing properly? Hand washing, perfect. Yep, Stephanie, thank you. And we'll really emphasize hand washing today. Medications, perfect. Yep, maybe they're not in the proper location or labeled. Holly, thank you. What else do you think are common health inspection citations? Use of sanitizer and disinfectant, exactly. We find often people are using a sanitizer for the wrong purpose or a disinfectant for the wrong purpose. Perfect. Or maybe it's not mixed at a proper ratio. Perfect. Okay, you can keep adding things in the chat, and here we'll go through this one and then, or go ahead. Marilee has a question. Go ahead, Marilee.
Thank you. I just wanted to make sure that you had seen the question in the chat from Stephanie. How many days do we need to go without a GI case before turning back to the normal 24 hours with these symptoms? I'm happy to answer, or you're welcome to go ahead and jump in.
I think hearing different voices is good. So please, Marilee.
Great. Stephanie, let me know if this answers your question. So if there's an isolated vomiting incident and there's not a further individual that has vomited, you can treat that as a 24 hours. As soon as you're in an active outbreak, then every single one of those instances will be treated with the enhanced precautions of needing 48 hours. So we will keep you informed when the outbreak is closed and you can return back to 24 hours only. Does that help answer your question?
Okay, Stephanie says, okay, yes, I will hold tight. Perfect.
I will peek at your illness logs today to see if we can swap you out of there. Thank you.
Perfect. And as you all know, whenever you give us your illness log and then we have an outbreak each week, we appreciate if you send us your illness log because then we can close the outbreak sooner with all of our paperwork. So thank you. So going back to the slide, common health inspection citations. So the hand washing sinks are not supplied with soap and or paper towels. And next slide. And so, the solution to the lack of soap and paper towels, a lot of this comes back on the director to keep the soap and paper towels well stocked and to schedule restocking. And sometimes we've talked to staff and they said, oh, I don't actually know where the location of supplies are. So that's just good when you do the training as well. Another common health inspection citation is the hand washing sinks are blocked with mouthed toys, the high chair trays, dishes, and even art supplies. Go ahead, Jane. Yeah, such as the brushes. So just brainstorming, what do you think would be, solution to blocked sinks? We have some there, a bin or a bucket next to the hand wash sink. I've seen in quite a few facilities, they have the yuck bucket. And then I think high chair trays are challenging, but they're, put them on the counter and then wipe, wash, and spray with a sanitizer. And they shouldn't even be in the hand sink. Another common inspection citation, which is what was said earlier with Stephanie, the sanitation and the bottles are not labeled properly for content and usage, and there's incorrect concentrations. So just remember, as usual with any chemical, follow the manufacturer's instructions for use. And then, as I said earlier, using sanitizer instead of disinfectant and using disinfectant instead of a sanitizer. And then, again, in the chat, or if you just want to share out, unmute yourself, what are some high touch areas in your facility? And then when you write those items in the chat, think about, would you use a sanitizer or a disinfectant when cleaning that high touch area? You can click one more time, Jane. So think about whether you'd use a sanitizer or disinfectant. And I think the next slide, will get you going. So the high touch areas, the tables and the changing tables, the sinks used after using the restroom. And I have a student working with me, disinfectant, perfect, thank you, Stephanie. I have a student with me who helped me make these slides. He's a CU student. He's a neuroscience student and interested in working with children. And so he's volunteering and learning a lot about cleaning, sanitizing, and disinfecting. So just the importance of cleaning. So you need to clean and rinse the surface before it's being sanitized or disinfected, because sometimes the sanitizer or disinfectant will not work or not be as effective if there's dirt and debris on the surface that you're cleaning. And then sanitizing, the definition is minimizing organism that causes illness, while disinfecting is eliminating most or all illnesses, or most of all organisms that cause illness. And I know for people who like mnemonic devices to remember these things, I think of S and S and D and D. So sanitizer and surfaces, and then disinfecting and diapers. So other items that need to be sanitized, surfaces in contact with food, utensils and dishes, toys and bedding. And then disinfecting the diaper changing tables, toilets, bathrooms, sinks, and any surface contaminated with the high hazard body fluids. And there's four main ones: urine, feces, vomit, and blood. And there you want to make sure you use the hospital grade disinfectant. Okay, next slide. So here we have examples of high touch areas in ECE programs. So we'll just start in the upper left-hand corner, and there you have a surface, okay? And my student, you can see he put a square over that, and so that means surfaces you would sanitize. And then the next one to the right is the changing table, and he put a triangle there because triangle is disinfect. And the next one again is disinfection, or the toilet and the hand wash sink after using the toilet. And then on the left again is the toys and sanitize because there's a square. And then the cots, sanitize. And then the toys, sanitize. So if any of you want to use these slides when you do trainings for your staff, Jane will send them out to everyone. So you're welcome to do that. And then just to re-emphasize, what are the situations that hand washing, people didn't hand wash? And so Kara and I have often seen when people enter the classroom, so staff who float, little humor here, there's a little guy floating, but I mean staff who float who maybe help in the infant room in the morning, but later they work in the 2-year-old room. And so those people, it's really important when they enter the classroom that they wash their hands. Or the children after playing outside, or after restroom use, or after sensory play. And now the before category, before they start in the day. And then if you are serving food, before you put your food service gloves on, and then before sensory play. And what do people say? So when we've interviewed people, what they've said, why don't we wash? Everyone knows, I think, how often can we talk about hand washing? But the reasons, and I've even looked into studies in hospitals, and they'll say too, soap and paper towels aren't stocked, or there's not enough time is one of the big reasons in hospitals. And it's the same in ECE facilities. And Kara said she often will see that children just watch the soap dripping from their hands. They're very fascinated by that, but they're not actually rubbing. And it's the rubbing action that actually removes the germs, and then they go down the sink. And then, of course, time constraints and maybe not enough places to wash hands. And then going back to the previous slide, the sinks were blocked, or sometimes the staff will say they didn't know when. We'll ask them, maybe you should have washed your hands before entering this room. They said, oh, I didn't know. So it's just important to train and to keep re-emphasizing this. So wouldn't it be nice? I don't know if you've all seen this Far Side joke. When a person walked out of their restroom, there'd be an alarm and flashing lights if a person didn't wash their hands. I think this would really help prevent the spread of disease. Next slide. So by continuing to promote hand hygiene in your facilities, there can be less GI illness, less respiratory illness, fewer absences, and fewer missed work days for parents and guardians, which leads to fewer missed work days for your staff, which is what I think we're all working towards. So just to end up this part on norovirus, I think with training, it's important to have resources which focus on just the children, the staff, and then the parents. And so children, it's important to have pictures. And Jane, when she used to teach in the classroom in preschool, she took pictures of the kids' hand and would make a collage. And so the children could see their own hands as part of washing your hands poster. Many of you are already using that 20-second timer at the sink and singing ABC. And then there's also a Sesame Street video which is just 30 seconds. We don't have to watch that, I think, in the element of time, but Marilee could maybe put that video in the chat if you wanted to share it with your children, or I think a big part of what you do is you educate the parents as well. And then resources with children. These two posters are created by the Centers for Disease Control. And I think children are always looking up to a hero, whether it's a princess or a action figure. And so even just putting these posters beside the hand washing sink can encourage children to wash their hands. And then resources for your staff. Marilee will put this link in the chat as well. If you just want to print this out and attach it to where your staff wash their hands. And then I think parents often really want to know just key facts, particularly about norovirus illness. They not only want to know how to prevent the spread at home, but just to educate themselves on what it actually is. So this is another good handout for parents. So just a summary of our disease update. Today we talked about COVID, norovirus, health inspections, the most cited violations in ECEs, and hand hygiene. And again, if you have any other specific questions, please contact our health ECE at bouldercounty.org for specific questions about any health topics. So thank you so much for the hard work that you do. We want to try to keep your facilities as healthy as possible.
Thank you, Martha, for making communicable disease fun. So Kara's going to just give us a brief update, and then we'll turn it over to our partners.
Thanks, Jane. Real quick before we move on to this, I just wanted to make a comment about or read one of the chat items so that it can be shared for the entire group. The question was, I want to confirm what was said earlier about the return to preschool after vomiting or diarrhea, that the student can return after 24 hours if there is not an outbreak. And Marilee did respond saying that isolated vomiting or diarrhea is the 24 hours following, the how sick is too sick. It's during the outbreak that we're asking people to follow the 48 hours symptom free until that outbreak is closed. So, and then obviously Martha with our health ECE will help centers work through that. So just wanted to make sure everybody who might be on the phone got that. All right, so mandatory lead sampling for drinking water. I just want to remind everybody that the deadline is May 31st, and that if you haven't already registered with CDPHE to get your free sampling supplies, that you'll want to do that. And I will put that link in the chat. And it is a great program. It is required, so you might as well use this program now to get it done for free. So that's really, I just wanted to make sure everybody was aware of that. So Jane, we can go to the next. All right. Clean air for schools. So right now CDPHE has a program that will help schools and childcare facility get a free high efficiency particulate air filter. They're portable air cleaners. The deadline has been extended to April 30th. And so I really encourage you all to participate with that. One of the things I find interesting, and I've been hearing a little bit, is CDPHE is contracted with Carrier West. So when you get some email response back, it's going to come from Carrier West. And a lot of sites have said, it looks like, is it a spam or is it solicitation? I'm not sure, should we open it? But just so you understand that is why you're getting emails from Carrier West, because they are contracting with CDPHE. That's it, Jane. Oh, and I will also put a link for the clean air for schools in the chat right now.
Thank you, Kara. And that I had linked it when I did the reminder last week. So you should have a couple places you can, if you're still needing the filter, the air quality HEPA filters. So Thanks for that reminder. And I'm not, Jody, are you available to update anything you'd like to update on CCAP?
Hi, I'm available. Thank you, Jane, and
Thank
thank you,
you.
Martha, for all that great information as usual. I'll take just a second to thank all of the programs that have been contracting with CCAP for many years, many months. And then I also saw one of our new programs on this call, so thank you for contracting with us. I want to remind everyone that we are still Boulder County CCAP is still paying up to 6 absences for programs and with quality ratings 1 and 2, and up to 7. And this is per month per child per authorization. So up to 7 for quality ratings 3 through 5. So, I think that ties in well with what we're talking about with kids getting sick and being out. It used to be that we could only cover 2 or 3, and now we are, and I don't see this changing anytime soon, up to 6 and 7 absences per month. If that was one of the deterrents for not contracting with us, as well as the rate increase that happened in July 2022, that is not going to backtrack. A really, really big one is the payment per authorization for children who are 0 through 36 months. And that just means, even if they're out for 2 weeks, you'll get paid. You'll get paid for whatever care is authorized for that child. You will get paid. Still have to use the ATS to check in and out, but you won't be losing any money if one of the younger children is really, really sick for 2 weeks. You won't be losing any money there. So happy to talk to anybody about contracting with us. There have been a lot of improvements to the ATS system. There's no more cards. There's no more, it's a web-based system, very easy to use. And like I said, the state has been updating that with some great enhancements that make it just easier for families, easier for providers to use the system. So I'll put my contact information out. I would love to speak with anyone who's interested. Thank you very much.
Thank you,
and happy
Jody.
spring. Happy spring,
Yeah.
everybody.
Happy spring. Spring is sprung. All right. Thank you, Jody. I'm not sure if Amy or maybe Amy, I think Amy might be out this week from the Early Childhood Council, and likely she gave someone else the update responsibility if you're there. I'm pretty sure I noticed Amy was out, and she has been doing some updates on an early childhood teacher clinic that starts in another week or so. So I'm not sure anyone else from the ECCBC available. Going once. All right. You've probably gotten a lot of information from them electronically as well. And I always give space for the Colorado Department of Early Childhood. If they're on the call and would like to update, we'd love to have your voice. I'm sure there's not a spare minute in their life right now. All right. Well, thanks for those partner updates. Thanks, Jody. And Kyla was going to give us an update. I believe she's on the call regarding the next 2 meetings. Did everyone cut out today for our?
I don't see Kyla as a guest.
Okay, well, Kyla made this slide, so I'll just tell you what it says if you're not able to see it, that we've been using one of the monthly meetings to do our health update, as Martha and Marilee and Kara gave information today, and the other 2 months using it to demonstrate some of our other wellness health promotion programs. So May 8th is going to be reducing food waste. They've been calling it a sampler. Whet your appetite. So they'll do a shorter kind of version of it and invite you to dive deeper into some of the other HEAL programs. This would be one aspect of it. HEAL stands for Healthy Eating, Active Living. And then on June 12th, also noon to 1, will be a farm to ECE update and where they're at and what options might be available to anyone and an update on that. Again, sort of a sampler. And then we will not meet in July, which would be the third month of that quarter, but we know everyone goes on vacation for July, right? So we're not going to interrupt your vacation, but we will come back to you the first week in August, and that's always a good time coming back to school, coming back into the fall, and do an update. And at that point, we'll make some decisions on how often we should hold these calls, what kind of content we have, and what the rest of 2023 will look like. So that's our plan through the summer. Is there any other questions? Any other thoughts? We have 3 minutes left. Drop the screen. All
Jane,
right. Well, yeah,
it's Mary Mann.
Mary. Yeah, go ahead.
Sorry. I just want to say something that maybe I shouldn't say, but I'm going to say it anyway, because it's positive. I really want you to know, as someone that meets with a lot of these child cares monthly, that what you guys have done and continue to do has really created such a feeling for them that you guys are on their team. And it is, I know in the past that maybe that wasn't always the case. They felt, oh no, the health department's coming. They don't feel that way anymore. And I just want you guys to know that they are, from what I hear from all of them, they're so appreciative of the time and the information and the support, the resources, and that you're giving them. It just means so much to them, truly. And so if I'm just being the advocate for the child cares that I work with. So.
Wow. Thank you, Mary Mann. I can speak for all of the Boulder County team that's well appreciated. And likewise, thank you, Stephanie. Likewise, we appreciate the
She's
work
one of
you're
my
doing.
directors.
And an awesome one. We love
Yes,
Stephanie.
she sure is.
And
Yep.
and I mean, I think it has been a partnership. We've fought the good fight for the last few years and learned a lot about each other and the resilience that we need and that we've developed.
Well, and just the even if it's quarterly, I mean, it was monthly when we were doing
Right.
COVID, which I know is hard, but just contact, like the fact that you're saying, hey, this is what we're citing for. So in preparation for their meeting, I mean, that's teamwork instead of coming in and, I know they appreciate it. And
thank you, Mary.
Yeah.
Well, and I think I appreciate what Martha said about if I'll get these we'll get the recording and the slides out to you and you can spread the good news. You can take this information and share it. And that would be a win-win. That would really be.
I always do.
Good. Great. So we won't go away. We may just we'll focus and we appreciate any of the input that of things you would like to know more about. And we're gathering information through inspections and the emails that Martha replies to. So we're not going away. We're just trying to really be responsive to your needs. So thanks everyone for the hard work. You are an essential population, a priority population in our minds and CDC. So we know that might not feel like it sometimes, but it's meaningful for us and it actually brings visibility to the work that you do. So thanks to everyone, and we'll go ahead and sign off and get things wrapped up. So enjoy the spring. Martha, do you have any final words of wisdom?
Thank you for all you do and keep getting lots of fresh air.
Yes, open your windows.
Yes.
All right. Thanks everyone. Have a good day. Thank you very much. for all of those kind words and messages.
Yeah, thank you. Thank you, Marilee, for your quick typing.
No worries. Thank you.
Yeah, thank you.